Hey there, science fans! Today, we're diving into the fascinating world of blood clotting. You know that process that stops the bleeding when you get a cut? It's super important stuff, but sometimes, our blood's clotting system can get a little out of whack. That's where INR and aPTT come in. These blood tests are like our eyes and ears, helping doctors understand how well our blood is clotting. First up, let's talk about INR. These are crucial tests that help us understand how well your blood is clotting. PT stands for Prothrombin Time. It's a test that measures the time it takes for your blood to clot. Specifically, it measures clotting along a pathway known as the extrinsic pathway. This is one of the key pathways your body uses to form clots. Think of it like measuring how fast traffic is moving on a highway. The faster the traffic, the quicker the clotting. INR, or International Normalized Ratio, is just a way to standardize PT results. This ensures that doctors worldwide can interpret the results in the same way. A normal PT is usually around 11 to 13.5 seconds. Meanwhile, a normal INR is around 1.1 or less. If your PT or INR is higher than normal, it means your blood is taking longer to clot. This can be a sign of an underlying issue. This could be due to various reasons like liver disease or certain medications. It's important to monitor these values to ensure your blood is clotting properly. Now let's move on to aPTT, which stands for Activated Partial Thromboplastin Time. This is another crucial test in understanding how well your blood clots. This test measures the clotting time along a different pathway called the intrinsic pathway, which is one of the two main pathways in the clotting process. Imagine this as measuring traffic flow on a smaller road, where fewer cars might mean a slower journey. A normal aPTT is typically between 30 to 40 seconds, indicating a healthy clotting process. If your aPTT is higher than normal, it suggests that your blood is taking longer to clot via the intrinsic pathway, which could be concerning. This could be a sign of a clotting disorder, like hemophilia, which affects the blood's ability to clot properly, or it could be a side effect of certain medications that interfere with the clotting process. Always consult your healthcare provider for accurate diagnosis and treatment. Section 4. Remember the acronyms. To remember these tests, here's a little mnemonic for you. INR, Prothrombin Time, International Normalized Ratio. Think putting on the traffic radio to check the highway traffic, which is the extrinsic pathway. And for aPTT, Activated Partial Thromboplastin Time, imagine a path through tiny towns, which represents the intrinsic pathway. Section 5. Why these tests matter, from medication to diagnosis. So, why are these tests so important? Understanding the significance of these tests can be life-changing. Well, they help doctors monitor anticoagulant therapy, ensuring that patients are receiving the correct treatment. People taking blood thinners like Warfarin need regular INR tests to ensure they're getting the right dosage. This is crucial to prevent complications. They also help diagnose clotting disorders, which can be critical for timely intervention. Abnormal INR or aPTT results can point towards clotting disorders like hemophilia or von Willebrand disease. Early detection can make a significant difference. These tests also assess liver function, which is vital for overall health. The liver plays a crucial role in producing clotting factors, so abnormal INR can indicate liver problems. This can guide further medical evaluation. Understanding your INR and aPTT results can be empowering. It gives you insight into your health status. It allows you to have more informed conversations with your healthcare provider and take an active role in managing your health. Knowledge is power. Remember, this is just a brief overview. There's always more to learn. Always consult with your doctor for personalized medical advice. Stay curious, my friends, and take charge of your health journey.